if there are ever any special topics that you would like for us to cover, feel free to email me. If there's certain information you want to hear about. We do have what we call a companion webinar to this one, which will be on March the 24th, and it's sponsored by one of our partners, Reality Works. And Denise DeBose is going to be talking about resources, free resources, and other resources that her company has that could be helpful to you in teaching medical assisting. So we thought it would be good to have those together. So today's presenter is Kathy Cilia, and she serves as the Deputy Executive Director for American Medical Technologists. And she is an expert in the field of medical assisting. And we are having a little bit of a technical difficulty in that Kathy couldn't get into the meeting. Don't ask me how that works when the presenter can't get in, but she's in by phone, and she's going to allow me to advance her slides. So we're going to tag team it, and that means I have to pay close attention. And so we'll try to see your questions in the chat, but we may pause throughout the presentation to say, are there any questions? And then we'll also have a few moments at the end to take questions. So just realize that I'm not going to be quite as good with the questions as I am sometimes. Again, I don't even think I said who I was. So I'm Nancy Allen, and I serve as Executive Director for the National Consortium for Health Science Education. We're glad you're here. And with that, Kathy, I'm on your first slide.
Okay, can you hear me okay?
We can hear you fine.
Oh, great. Well, thank you for having me. And again, I just like Nancy said, I apologize for the technical difficulties. Not really sure what happened, but things do happen. So we go to a plan B or sometimes C, and we'll just move along here. So today we're going to be talking about medical assisting, which I refer to as a flexible profession, and you'll see why that is in a few minutes as we go through the presentation. So Nancy, next slide, please.
Okay, I'm on the slide with your picture.
Yep. So in today's session, we will cover the job outlook and demand for medical assistants. We'll talk a little bit about where medical assistants work and what salary they can expect to get once they're out in the workforce. We'll talk about competencies or typical tasks that are performed by medical assistants. And then finally, we'll talk about preparing medical assistants for the workforce and what you can do to make them be a success. So next slide. So I usually put this slide, this is about AMT, and I usually put this slide at the end of my presentation, but I wanted to put it up front for several different reasons. One is because we're going to be talking about credentialing, and we are a credentialing association, so I just wanted to kind of put that out there as a disclaimer, but also show you that we have been around for a long time, since 1939. And in addition to being a credentialing agency, we're also a professional membership association. And we have a lot of members who are medical assistants, about 70,000 of them working in the field. And so we live and breathe medical assistance every single day. And so we'd like to think that we know something about that profession. But then in addition to medical assisting, we also have a number of other allied health professions that we provide certification exams for, and those are listed here as well. So it shows you the depth and breadth of what we do and how we operate in the allied health space. Okay, next slide, please. So first, a little bit about the definition of a medical assistant. And that profession can be called several different things. Sometimes they're referred to as a clinical assistant or a healthcare assistant. But for the most part, if you look at job ads, it will refer to this profession as a medical assistant. That is the most common term used. And it is defined as an allied health professional who supports the work of physicians, physician assistants, and other health professionals, especially nurses. And allied health, just as a term, if you hadn't really heard that term before or were unfamiliar with it, it refers to basically anyone who is not a physician and not a nurse. Okay, so next slide, please. So this kind of shows you how medical assistants fit into the patient care team. Of course, you have the patient at the center. You have your doctor or your primary care physician as your, the person that takes care of you. You have a nurse. You have a variety of different specialists. So, for instance, you may see an allergist or a orthopedic surgeon. So those are all the specialists that are part of your team. And then there's a whole host of other staff called support staff, and medical assistants fit into this category. So they are definitely there as part of a team and a very important part of the patient care team. Next slide, please.
Okay, Kathy, you may be going to discuss this, but there was a question about age requirement.
Yes. So for some aspects of medical assisting, someone would need to be 18 years of age, especially when it comes to drawing blood. I believe that most employers will require that you're 18. So in those particular instances, they could go through all of the steps and even take an exam, certification exam, be certified, but then submit that final. We require that they have so many needle sticks and venipunctures in order to officially be certified, and they can obtain that once they turn 18 and are working out in the field. And sometimes an employer will hire them and make them, allow them to do other duties until they reach that certain age. But I would say for the most part, there are only a few things that they cannot do. Externships, I've heard, are also maybe a little more difficult to obtain because of liability issues, but sometimes you can work around it. Especially this year, we see it in COVID times that people have volunteered different places and have been able to obtain their externships that way and then become certified. But as far as employment, I haven't heard of an age requirement, but maybe for specific duties of a medical assistant, there might be an age requirement. So I hope that I answered that individual's question appropriately.
Thank you.
Okay, so we're on the demand outlook slide. So when looking at demand and outlooks of different professions, I tend to go to the U.S. Bureau of Labor Statistics. They have an occupational outlook handbook, which is very handy, and it gives you lots of different information. So for medical assistants, they said that in 2019, there were 725,000 medical assistants employed in the U.S. And the job outlook is projected to be much faster than average in the next decade, although we're already a couple of years into this decade, at a rate of 19%, which is really pretty good. So if you wanted to take a look at this source a little more closely and see what other information there is, at the end of this presentation, I have a slide with a number of links to resources, and this will be one of them. Okay, so next slide, please. The U.S. News and World Report usually puts out college rankings, and you may have seen other rankings that they do, but for jobs, I came across this, and it's just telling you that medical assisting as a job is very popular, and it's considered to be one of the best jobs, either with a college degree or, it's listed in the top 100 best jobs overall. And so, again, it just fares very, very well as something, a field to get into. Okay, next slide, please. So where do medical assistants work? I would say the majority of them work in a physician office of some sort. That is typically where they are found. There's different types of clinics and so forth, but yeah, typically you'll find them in a physician office. I've listed a number of other sources as well. They sometimes work in nursing homes, assisted living, rehab centers. You will find them very rarely in a hospital. They tend not to work in a hospital. That's usually patient care techs and certified nursing assistants mostly. But so they're mostly in an ambulatory setting. So mostly in physician offices. Next slide, please. And it's not just any physician office. You know, you have your internal medicine, family practice is your basic physician office, but there's a number of specialty clinics, and I've listed just a few of them here. And I even, the last two bullets list unusual places where you might find a medical assistant, like a veterinary office or a public health facility, even like a school. There's a variety of different places that they can work, and hence the flexible profession part of things. So they are just a variety of different settings that they can work in. Next slide, please. So what is the expected salary of a medical assistant once they graduate? Next slide, please. So I again turn to the U.S. Bureau of Labor Statistics for wage information, which they're very good at providing. So here they've provided in 2019 what the median wage was for medical assistants, as well as the lowest and highest 10th percentile. But probably the most important thing on the slide is that last bullet that says that salaries do vary widely depending on your education level, the number of years of experience in the field. Geography plays a big part. So for instance, if a medical assistant is working on the East or West Coast, they will typically get a higher salary than if they're working in, you know, somewhere in the Midwest or one of the plain states, let's say. And then work setting is also something to consider, not just the type of practice, whether it's a specialty practice or not, but then also if it's in a rural or in an urban setting, that will also vary the salary. So I give you this information, but just understand that it does vary depending on where you work and where you live. So next slide, please. So now we're going to talk a little bit about competencies for medical assistants. Next slide, please. So the medical assisting scope of practice can fall into or falls into two basic categories, the administrative side and then the clinical side. And first I wanted to mention that as far as state regulations, the scope of practice varies within the different states. So for instance, the state of Washington is the only state that actually licenses medical assistants. So you actually need a license in order to practice in the state of Washington. Currently, that's the only state. There are other states that are attempting to do the same thing, but so far have been unsuccessful. Then there are other states that limit the scope of practice in one way or another. And an example of that is what I've listed here in a yellow bullet, vaccines and immunizations. So the state of Connecticut and the state of New York are the only states that don't allow medical assistants to do vaccines, which is really too bad in this COVID environment. And they're actually reconsidering this at the moment because we need all the help that we can get to get those vaccines out to everyone out there. So currently, those are the only two states that do that limit medical assisting scope of practice in that way. So the AMT has compiled a We have a compendium of state regulations concerning medical assisting scope of practice, and I've included a link on that resource slide at the end of the presentation. It is from 2018. That was the last time that we've updated it, but frankly, things don't change all that much. And in addition, if you look up your state, you will see like one of those federal numbers that you can copy and paste into your browser, and you can go directly to the link and see if anything's been updated. But that's a very, I think, useful resource for you. That's a state by state, what is required in each state. Okay, next slide, please. So just to give you an idea of what a day in the life of a typical medical assistant might look like. So when you first go into a physician office, there's what's called the pre-visit, and there a medical assistant may greet you, well, first of all, I guess they schedule and confirm the appointment, and then they check you in. When you do come in, they obtain your insurance information. They may have you sign some HIPAA forms and other needed documentation. So because of they're trained in this administrative duties, this is part of that those tasks that they perform. And in a larger clinic, that's maybe the only set of duties that they perform. They never go to the to the back office to actually do any exam things, but they stay in the front office part of the clinic, and this is all they do. They kind of specialize in that. In a smaller clinic, you might see more variation where they, one day they might be in the front office, and then they're scheduled to work with actual patients in the back on another day. Okay, next slide, please. So during the actual clinical visit, a patient will come into an already disinfected room, and the medical assistant, I don't know how it is in your state or where you're from, but at least in the Chicagoland area, the very first person that greets you when you get roomed is a medical assistant, and they take your history. They note any changes that you've had to your health, and they make those changes in the patient record. They verify any medication that you are taking, and then they take your vitals, your blood pressure, your height and weight, and your pulse, and so forth. And then they may stay in the room to scribe for the doctor in the electronic medical record. They are trained to do that, and they can, and sometimes they do, and sometimes the doctor prefers to do that himself, or herself. But they are trained to do that, and they can if called upon to do so. Okay, next slide. So after the doctor visit, they can perform a number of different clinical tests. So for instance, if an EKG needs to be done, they are trained to do EKGs. They change dressings. They can obtain all sorts of different samples, like a throat swab, or they can even draw blood. And in most states, except for the two that I mentioned, they can actually do vaccinations. Then after the doctor leaves the room, they go over the visit with you, any changes or special instructions from the doctor. They'll go over that with you. They could schedule a follow-up appointment. Then they could perform simple lab tests, what are called wave tests. They can even do insurance and billing, but sometimes that's done in that front office area. And then they can pre-authorize you for other specialty procedures. So these are just like, the typical things that they do in the course of a day. The next slide, please. So how can you prepare students for a successful career in medical assisting? Next slide, please. So I found this a very interesting bar chart. So as you can see, most medical assistants have some college, not necessarily a degree per se, but a diploma. Some go on, and some programs are associate's level. very few are bachelor's, but I point you to the high school diploma or equivalent at 20%. And I believe that this is actually on the upswing. So I think there are more and more high schools, at least we're seeing it on our end at AMT, more and more high schools that have fairly robust programs. So that's encouraging to see and to see that number grow. The next slide, please. Nancy, you could do chats for now because I'll spend some time on this slide. So before you start looking at the specifics of this slide, let me just explain what I did here. I wanted to give you all job ads, sample job ads from various healthcare systems across the country. And I chose large healthcare systems for several reasons. One is because they usually are the ones that other healthcare systems follow within the state. So because they're competing for talent, they are competing for the same pool of people. Other healthcare systems tend to follow what the largest healthcare system in the state does. And in addition to that, larger healthcare systems, sometimes, they do mergers, acquisitions, or they gobble up small clinics in the outlying areas. And so they kind of spread they have a bigger footprint, I guess, in the state. And so what happens in an urban area you may see elsewhere in the state. So having said that, though, it's not always the case that what happens in a major healthcare system will also follow elsewhere in the state. So usually, not usually, but sometimes in the rural areas or the more remote areas of the state, you will see a little bit of relaxation of these requirements. So now let's take a look, and I've summarized these job ads based on two categories. So I've looked at the education requirements and then also whether they require a national certification, and if so, by whom. So this is just a sampling. Not saying all of the healthcare systems do this, but this is, again, just to kind of give you an idea. So for instance, in the state of California, there's no education requirement, although they do prefer 1 year of experience. But for certification, they do require certification from one of two agencies, and they've listed them here. The RMA is actually the certification offered through AMT. Or completion of a program. In Denver, however, they do want someone to graduate from an accredited post-high school program. And accredited means a program that is accredited through someone who is approved through the U.S. Department of Education. And so in Denver, at least for Denver Health, it might be tougher for someone just graduating from high school to hop directly into a job. But they do require 160 hours of externship, and we'll talk about that in a second. In Texas, again, graduation from an accredited program, and then they do require National Registered Medical Assisting certification. Then you'll see that, or obtain certification within 90 days of hire date. We see this a lot where even if you don't have a certification, they will hire you and then expect you to take an exam and pass it, obviously, within the first however many days. Sometimes it's 90, sometimes it's 120 days of hire, so that you will see that a lot in job ads. In Florida, high school graduate, and then some sort of training is required, and then certification from one of 4 different agencies. In Illinois, it's only a high school diploma, and then again, the certification. New York, same thing, high school diploma, and then certification. So you'll see a trend here that no matter what the education requirement is, most of these do require certification or credentialing at the end. So this is just to give you an idea. Again, it's not to say that every single job will require this, but it just gives you a sampling of what to expect if you want your high school students to be ready to work without actually going to a post-secondary school for further education. Okay, next slide, please, Nancy. The ideal curriculum, we just mentioned 160 hours of externship, and that is required by programmatic accreditors for medical assisting, and there are two of them. APHES and KHEB are the two programmatic accreditors. And even though in the past they have required a certain number of didactic hours, like 560, they've gone away from that and have it be more outcomes-based. That everything's kind of moving to an outcomes-based performance. But the 160 hours of externship still stays. And so a lot of these post-secondary programs will actually be 560 hours of didactic, no matter if it's required or not, plus the 160 hours of externship. And the certification agencies will follow suit and make sure that those programs are of that length. And they require this because they want to make sure that the program is robust enough and adequately covers the areas of competencies for the medical assistant. So they think that it takes that many hours for them to really get a good understanding of what is required. Now, having said this, there is, we have seen some programs, especially from high schools, that aren't necessarily nearly this long. And we approve them because we have this mechanism of going to our expert committees, and they, the school can submit their syllabus and we can review it. And sometimes, even though they don't meet these particular requirements, they are perfectly fine and have enough hours and cover all the materials, and we approve them, and their students can sit for our exams. So this is, again, the ideal curriculum, but if you don't have nearly this much, it's not the end of the world. It's something that that perhaps more and more agencies can accept. Next slide, please. So your curriculum should contain most of these, all of these. Obviously the anatomy, physiology, medical terminology, so forth, and then, of course, focusing on the administrative side and then on the clinical side. And AMT has an exam content outline that is 16 pages in length, and so it's very detailed about what topics are covered on our exam. And this slide is a summary of those of that 16-page document. Now, I have provided a link to that document on that resource slide. So if you wanted to compare your curriculum to what is covered on a national credentialing exam, that would be, a good resource for you. So you're more than welcome to. I encourage you to take a look and see how your program does. Next slide, please. Okay, so what can you in particular do to make your students be work ready and really kind of stand out among everyone else that is competing for a job? So I've got a couple of ideas for you. So slide 23, please, the next slide. So obviously we're here at a Nishi presentation, and I would be remiss to not mention some of the great resources that Nishi has. And starting off with the health science standards. This is kind of the foundational step of, if you think of this as a pyramid, this is the bottom of the pyramid. This is what every student who is interested in healthcare in general should know before they advance to the more specialized areas as you move up the pyramid. So there are 11 standards. There's some detail underneath each of these standards. So I encourage you to take a look at them, and I've provided a link for that as well on the resource page. Next slide, please. So other resources that Nishi offers, we Nishi has some curriculum enhancements, things to help boost your curriculum if you need help, and then some experiential learning opportunities, some suggestions, and so forth. And then I listed a number of different credentials that you can take all along the way to make sure that your students are, you know, picking up the knowledge that they should in preparation for that final industry recognized national certification, which is the last bullet on the slide. It's actually not a Nishi resource, but I listed it here because it's part of the credentialing, you know, kind of the steps. So Nishi offers 4 end of course stackable credentials, and they're listed here. They also offer an end of program certificate. So at the end of each course and then at the end of the program. There are also discipline-specific certificates offered by Precision Exams through U Science, and there are specific ones for medical assisting. So again, if you want a good preparation for your students, make sure that they're ready for that final exam, the national credentialing exam that employers are looking for. This would be the way to do it. Just make sure that, you know, that they're advancing at and understanding what you're covering in your courses. Next slide, please. So we often think of career ladders, right? So what can you do to move up the ladder? What types of positions can you have? And then sometimes we don't talk about lattices, and lattices are kind of parallel steps to the ladder. So it's especially useful when talking about medical assistants because there are so many different things, like again, the flexible profession. There's so many different things that they can do that if they take a special interest in an area, they could do like a little side step and then do either more training or get more work experience and then advance in that profession. So just to give you some ideas is on the next slide. So first, ladders. There are many medical assistants who become practice managers. So they manage a clinic. They can become healthcare administrators, and if they like the financial and the insurance part of things, they can be managers of those areas. A lot of medical assistants go on to nursing, and some even make it up to the MD level. On the lattices side, again, it's those subcategories of competencies that they do. So if they're interested in lab, for instance, they more than likely will have to get some more education and training, and then they can become a medical technologist or a medical lab technician. Now, there is a medical lab assistant, which is an entry level, and they can probably do that from the courses that you offer. So if they're interested in a lab, they could just sidestep right there. There are other occupations as well. They can, if they like EKGs, they could become an EKG technician or a technologist. If they like drawing blood, they can become a phlebotomist and so forth. And so just to give you some ideas. Okay, next slide, please. Actually, second to last slide. So this is the resource page that I've been referring to. It has a number of links for you. The Bureau of Labor Statistics, our exam content outline for medical assistants. It's that 16-page summary of what is on our exam. The compendium of state laws, and then APTES is the accreditor that has the programmatic accreditor that has the medical assisting standards that list 160 hours of externship. That's considered really the gold standard. And then some of the Nishi resources, direct links to where you need to go so you don't have to go searching. And the next slide, this is just my email. If you have any follow-up questions, I'd be happy to answer them. Or if we have any questions now, I'd be happy to answer that as well. And I'm hoping, I think I have 1 or 2 of my colleagues on, and so maybe they've been helping out in chat as well. So that kind of ends my presentation, Nancy. And
okay. All right. Well, I do have a question for you from Cheryl Young, and I'm going to read what she put in the chat. And then if she needs to unmute herself, because I'm not a good interpreter of what she's written here, then we'll have her do that. But this is from Cheryl, and she says she's a little confused. There's no education requirement for hire. However, they require a AAMA certification. Is that under the current AAMA pilot program?
So I believe the AAMA does have a pilot program where they're looking at different education or experience routes. Yes, there is a pilot program going on. That's another agency. So I believe I have heard that they have a pilot program, so that so somebody does not necessarily have to be from an accredited program in order to take their exam.
Okay.
So that is a pilot program, I believe. But for instance, he has a work experience route. So
she went on to say, it's my understanding education was a requirement for AAMA. I thought you had to have graduated from a KHEP or ABHSE, or ABHSE, I mean, HES program. Can you clarify? Thank you, she said.
So yes, currently AAMA does not have a work experience route. So in order to sit for their exam, only students who graduate from an ABHES or KHEB accredited program can sit for their exam. But in that pilot, they are looking at other options. So it's still a pilot, from what I understand. But yes, you are correct. You have to basically come from an ABHES or KHEB accredited program in order to sit for their exam.
Okay, thank you. There's another question here from Carrie Arnold, and she's asking, do you need a certain credential to be able to teach an MA program?
No, you do not. So for as far as certification agencies, we don't look at the qualifications of an instructor. That we leave to the accreditors if your program is accredited. Now, I will say that accreditors sometimes require that you are certified in the discipline that you teach. I don't know how solid of a requirement that is. You know, there are many different types of accreditation. So there's institutional accreditation, regional, and then programmatic. Programmatic accreditation, which is the KHEP and ABHES that I referred to earlier, is probably they have the strictest standards. Institutional is like your whole institution is accredited by someone, and they tend to have more flexible requirements, and not very specific to like instructors. But for someone with programmatic accreditation, they may require, and I believe I've seen that they instructors have to be certified in the discipline that they teach.
And so I'm asking this of you, Kathy, of American Medical Technologists. You all don't accredit programs, but you certify students. Is that?
Yes.
Okay.
Yes. Accreditation is for entities like programs and so forth, and certification is of people. And so we don't accredit school programs. We leave that to others. But as an eligibility criteria for students to sit for our exam, we have certain requirements, and some may require accreditation, some not. For instance, like I said before, we have a work experience route. So some medical assistants are actually trained on the job. And so if they had been working for 5 years, let's say, and they've acquired enough knowledge and experience to sit for our exam, sometimes those students do better than those going through programs, frankly. But we allow different qualifications, I guess, to take our exam.
Could you speak to the average cost of a certification exam for a medical assistant? I know you obviously know what your organization charges, but I didn't know if you had sort of a knowledge of an average. In addition to, you're welcome to share your cost as well.
Right. Our cost is $120 for the exam. I would say most of the four that were listed in those job ads, those are probably the top 4 certification agencies out there. They're fairly similar. Some are a little bit higher. Some will kind of work with you, you know, depending on how many students you have or so forth. But it's typically in that range.
Okay. And is yours all computer based? Do they go to a computer center, or how do they test?
Right. They go to we work with Pearson VUE testing centers. So they would have to go to one of those facilities. Sometimes the school itself can become an authorized Pearson VUE site, and they can use their computer lab if they have the right setup. You know, it has to have certain types of security measures in order for it to be considered a high stakes testing facility. So they have to have the dividers in between and so much space between. So a school can become an authorized Pearson VUE site. Now, because of COVID, several certification agencies, and AMT is about to do this, we're going to live remote proctoring. And so we will be offering this. We're a little bit behind the others, but that's where you could take the exam anywhere, but you have to be alone in a room, and you are monitored live by a proctor, by a Pearson VUE proctor. So they will watch you and make sure that you are not looking around and so forth. So it's called live remote proctoring. So we are, that's a fairly new thing for medical assisting certification exams because of the COVID situation. But I think that will stay beyond COVID.
Does the student incur an additional charge for the remote proctor?
No, same fee.
Okay.
At least for AMT, it's the same fee.
Okay. Okay. Well, you know, they always love a professor that lets you out early, right? So Kathy had a little panic there at the beginning because she couldn't get on. And so we were able to make it work by having her call in, and I got to be Vanna White, and it all worked out. And
yes,
so we appreciate all of you that were here. Remember that the recording will be posted at our website under webinars, as well as Kathy's PowerPoint. So I know that she had some great information there, and somebody said that in the chat. As a matter of fact, Kathy, great information. So her PowerPoint will be there as well as the recording. And Kathy, did you have any parting words for our friends, or if anybody, we have a couple of minutes if anybody needed to unmute themselves and shout out a question.
Thank you for this opportunity, and I do have my email on that last slide. If you can think of other questions, I'll be happy to answer them offline.
We're very pleased that American Medical Technologies are a member of the National Consortium for Health Science Education. They're in our professional association category, and we just appreciate their willingness to do a webinar and also to keep us current with what's happening in this profession. And thank you, Kathy, for mentioning the National Health Science Standards, as well as other certificates that we offer that could be good preparation for these students. So everybody have a good rest of your day. If you're interested in a certificate of participation, you should have that email in your email, and also I'll put it there in the chat for you. Thank you again, Kathy.
Thank you all. Bye.